Well, the COVID-19 pandemic has affected every area of society. And the reality is no one is safe. So today, we're kicking it off by taking a look inside the pandemic behind bars. Since the coronavirus pandemic hit, millions of people have become accustomed to a new way of life, wearing masks, rigorous hand washing, and social distancing. But what if you're in a high-risk situation, unable to protect yourself on a daily basis? For a large group of Americans, this is reality. Over 2 million people are incarcerated in the U.S., and in many facilities, social distancing is extremely difficult, masks are not mandated, and COVID tests are hard to obtain. There's a major uptick of COVID-19 ravaging jails and prisons around the country. But inmates aren't the only ones at risk. Over 31,000 prison and jail staffers have contracted the virus, with some even bringing it home to their loved ones. Many states are doing their best to prevent future outbreaks, but as they're in the midst of a second wave, inmates and staff alike are scared for what's to come. I'd like to introduce Dr. Alysse Wurcel. She's an infectious disease physician at Tufts University School of Medicine. Dr. Wurcel, thanks for joining me today.
Thanks for having me.
So you work directly with local jails to monitor infection rates, COVID infection rates. So what are some of the specific challenges that the jails are facing?
So the jails have people coming in and leaving pretty quickly. And so what happens is if you incarcerate someone and you test them that day, it really doesn't mean they don't have the virus. It's just a snapshot of that day because they still could have the virus. So there's a lot of isolation and quarantining that's going on, even when using testing. And that definitely has a psychological toll on people who are incarcerated. And then what the biggest issue that I found was actually getting testing to the people who are incarcerated. And what we did early on is we tried to partner each of the jails with an academic center. We're fortunate in Massachusetts, we have tons of academic centers. And so the academic centers took on the jails and started providing quick testing. And I really think that was the key to getting out of it. That is one part of it. And then just decarceration. So our jails were able to really let a lot of people out. And I think that permitted social distancing as much as could happen in a jail. It allowed people to have their own cells. It allowed people to be spaced apart.
And then, you look at whether or not the jails or prisons are even set up to be able to deal with COVID when you think about the way it's laid out. I mean, you can't keep everyone in isolation. Are you going to keep people from, eating, near each other? I mean, the jails and prisons have a really tough road to hoe because the logistics of it just are, not great.
Yeah, I mean, the jails and prisons, the system was created hundreds of years ago to punish, right? The jails are also charged with providing health care right now for people who often can't access health care on the outside. The actual physical structures of jails and prisons are not malleable very quickly, yet in the setting of pandemics and epidemics where we want to encourage ventilation and we want to encourage people to be outside and all of these things happen. So yeah, absolutely, they're not set up for that. And we've seen this through previous infectious diseases epidemics like tuberculosis. So it's basically, it's working with what you've got, acknowledging it's not perfect and try and keep people as safe as possible. And yeah, I did lose sleep over it, but I think in the end, we've put together some solutions, and I think honestly we've done a good job.